What's that testing?
Dull or sharp sensation.
Okay. So
Cranial
cranial
nerve.
nerve 5, 7, and 9
5,
was just
7.
that was all clenched teeth and the dull and
Sensation. Clenched teeth was 5.
Okay.
And then 7's sharp. 7 and 9 are sharp and dull.
No,
Correct.
5.
Well, 7 and 9 are part of 5, but I moved to, I started to move towards 7 and 9. Sorry about that. If you could wrinkle your forehead, smile, puff your cheeks out. Smile, puff your cheeks out. And then if you could raise your eyebrows. If you could grimace. Good at this. And then we would next test your jaws for here for any pain or tenderness of your temporal mandibular joint. Are you able to move your jaws kind of from side to side? Does that bother you at all? Okay. No crepitus or clicking. Can you open and close? Next, if you could repeat after me.
Merry Christmas. I got it, man.
And so he mentioned those phrases appropriately. This is where we were talking about if you decided to not do that test, but you did the Renee or the Weber, that would be fine. You could talk through, if you did either one of those, you could talk through air conduction being greater than bone conduction, or that could be a question that Bill or I may ask you guys, or a question that you may see on the test related to ear and that nerve. As you move through 9, 10, and 12, I'm still going along there. You could look at and have the patient say, and with this particular patient, I don't know if you guys remember before, his uvula is not midline. And so if you happen to pull neuro and have Nate, that's something that we would expect to see in your documentation. And so that Bill or I would look to make sure that you document that. There's a couple other people that have a deviation with their uvula, so you'll want to make sure that you're able to document those things. So that's kind of some of the deviations you'll look for in your documentation. I won't ask that anybody stimulate anyone's gag reflex, primarily because I don't want to clean up vomit. And then we'll ask you guys to, if you could stick your tongue out. Can you move it up, down, and then can you stick it back out? Move it side to side. Okay, so then you'll note that he was able to do that without any difficulties. You'll also note that there were no bulges, that he experienced no pain. You didn't note that there were any lesions on his tongue as well, and that it appeared that his strength of his tongue was appropriate in terms of movement, is what you'd want to say. If you could repeat the letters or consonants L,
L,
T,
T,
P,
P,
S,
S,
and C.
C.
You can have them repeat any of those consonants, or D or N. Actually, any consonant, anything other than a vowel is what we would say there. As you move down to your cranial nerve 11, can you shrug your shoulders? And then can you turn here into my hand? Into my hand again. And then can you push your head back? And then forward. So muscle strength was appropriate as well. I won't have him take off his shirt, but you would want to make sure, and I'll go back, I missed this myself. And if you do this, it's fine to just say you'll want to inspect and just kind of make sure that there was no muscle protrusion or bulging at the time that he performed any of those testing, going through those pieces. And then we'll move through our cerebellar function. If you could move to the edge of the bed, I'll have you.
Do we want to do this?
Oh, yeah, that probably works. Excuse me. if you will place your hand, and what we're going to have you do is, if you follow after me real quick, as fast as you can. And close your eyes a little. Can you do just your right hand? Left hand? Okay. Are you right-handed or left-handed?
Right.
Really? Okay, pretty good. So then from there, so awkward. If I can have you lay back in the bed. And we're going to have you perform your heel to shin. If you could take your right leg and place the heel just below your knee and slowly slide that down towards the heel of your foot and then back up. Do the same thing with your left extremity, please. Okay, good job. And then from there, we are going to have you do a heel toe walk, and then we'll have you stand up and do your round bird. So if I can have you stand and just briefly walk heel toe here along this line here in the middle.
Don't ever want to have to do this besides for right now.
And then as you walk back, if you'll close your eyes, hold your head up, and put your arms straight out.
Oh, wow.
That's good, you're fine. And if you put your feet together and face towards me and close your eyes, and we'll perform the round bird test, and you can do this for 60 seconds. We just want to make sure that there's no swaying or steps forward. For sake of time, we won't have them do it for 60 seconds, but after about 40, anyone, you can open your eyes, anyone will start to kind of feel that way. Although someone left my house on, oh, I'm on videotape, someone left my house, I should have performed that test on them, probably. So then we'll move to our sensory and tactile function. And basically, I would just tell you guys, if you test sensory function in all different areas with dull and sharp, meaning we'll start, if you close your eyes for me and just tell me if it's dull or sharp.
Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp.
So if you'll just test the sensory function in all extremities is what I would just make sure that you cover. We can